Hi, my name is Gary. Today I'll present to you the architecture of thought, deduction, induction, abduction, and adduction, navigating uncertainty with structured reasoning. I'm a medical doctor by training with a master's in public health as well as a master in business administration. Let's start. Why do we need to do this? Because number one, we would like to diagnose more accurately, we want to strategize more effectively, we want to innovate responsibly, and of course, we want to avoid failure. Let me show you how. Let's start with deductive thinking or reasoning. Rule: all patients allergic to penicillin should avoid amoxicillin. Jane is allergic to penicillin, therefore Jane should avoid amoxicillin since amoxicillin is an antibiotic that belongs to a penicillin class. This is you applying general rules to specific case. It is widely used in medical protocol, legal ruling, and financial auditing. Inductive reasoning. So first we collect data. In 50 patients with high body mass index, 45 had insulin resistance, which means a sort of pre-diabetes. This pattern will show a correlation between BMI and insulin resistance. So high BMI is likely associated with insulin resistance. But whether insulin resistance leads to high BMI or high BMI leads to insulin resistance is unknown. As they mentioned, correlation is not causation. So induction forms generalization from specific observation. It powers clinical epidemiology, customer analysis, and policy evaluation. You collect some data and try to make some sense of the data. We have abductive reasoning. For example, a patient has fever and high heart rate, tachycardia, lungs are clear. So what are the possibilities? So it could be pneumonia, it could be sepsis, it could be viral infection. From here, since it's elderly, or you might not mention it's elderly, urinary source is one common cause of infection. So that's where we diagnose it to be likely from there. So what we'll do is we'll probably do a urinary test. If it's positive, then we have the diagnosis. We may or may not do a chest x-ray because the lungs are clear. But if not sure, we can also do a chest x-ray to exclude pneumonia. Deductive reasoning. This is not commonly used. This is something I came up with. Basically, it's coming out with a creative use, integrative use of solution. For example, if you want to have a hybrid model using so start off with possibility. What's the best way to pay providers? Is it capitation, where everybody is paid per patient? So no matter how much you do for one patient, you're being paid the same amount. Is it fee for service, which means that every service you provide, you tend to get paid? Or should you do a value-based bundle? Once you decide on a bundle of services, have a certain fixed rate. If there's cost savings, it can be shared, and so on. The next step is to evaluate options with the strength and weakness of each approach. You can read more about this in some of my other lectures. For capitation, the biggest problem is care rationing. Because if you are paid the same for each patient, you may want to do too much for the patient, and you may also want to avoid riskier patient because you're being paid the same. Fee for service, the problem is that you may overdo things because you're being paid on a per service basis, piecemeal. So these are the problem. Value-based bundle, I think the biggest problem is that it's hard to define a bundle, what is included, what is excluded, and it's very difficult to align people together. So finally, we may have a hybrid model that both uses capitation with quality metrics to ensure there's no care rationing. So there are some ways you can design it to address the deficiency. So Adduction chooses or synthesizes the best option from several possibilities. This drives innovation design, health policy, and strategic planning. So the difference between an idea and innovation is that innovation provides usefulness from an idea, and idea is just an idea. So comparative framework. So obviously, deduction is from general to specific. So this is commonly used in clinical protocol. There's the only problem is that there is some over-reliance on assumption, but there's certainty. Induction, from specific to general, this is pattern recognition. You can over-generalize, and then some of these things is provide insight from some limited data. Abduction, from observation, come up with some cause. Some clinical reasoning is the best guess. The problem, it can be wrong, but it's a pragmatic way. Yeah. Adduction is using many to find a best fit. It's very useful for innovation. Sometimes the infusion can be suboptimal, but the key is that the solution is integrated. Okay, finally in action, what do we do? So deduction, what you can do is logic tree, use rule base to drive conclusion through clear structured pathway, most certainly, but requires valid premises. Induction, collect data, from the data build a theory through observation. It can reveal insight, but sometimes can overgeneralize. Abduction is a diagnostic guess based on best available evidence. It's practical because you can't know everything, so you use a best guess. It's prone to confirmation bias. Sometimes what this means is that sometimes when you think of something, the test they rule it in, you consider things that rule out, you will actually exclude and not include in it. So this is called confirmation bias. Adduction is considered creative synthesis, building optimal solution for multiple inputs. It's innovative, but sometimes may miss simpler approaches because you're trying to overcomplicate things. So reflection and takeaway, there's no one size fit all reasoning style. You need to master all modes for comprehensive thinking. As they mentioned, if you only have a hammer, everything is a nail. What is the default style? Do you like to think big? If you think big, then you can try to come up with specificity. Or are you a detail-oriented person from the data to generate insights? Are you a creative person who want to look at different synthesis? Or are you a person like to take risk, the best educated guess? So your style will depend on what thinking that you move towards predominantly. And finally, flexible reasoning unblocks boundless solution. And finally, wisdom lies not in certainty, but the flexible use of structure. Thank you for listening. This was made by Gamma. Thank you so much.